efficiency is super important to us in our practice. In the ortho profession, many of us are taking too many appointments to finish patients' treatment. Our goal in our office is 12 or 13 appointments to finish treatment on average. SmartArch is a wire technology which effectively allows us to replace what took 4 wires to level from crowding to relatively straight teeth, and cuts that down to 2 wires. What we've been doing with it is reducing the time to straight teeth from roughly 8 or 10 months to roughly 4 to 6 months. So in our office, it's saving us about 3 to 5 months of treatment time and probably 2 visits, which is valuable to both the office and valuable to the patient. What we're seeing with SmartArch is that it provides ideal forces to individual teeth in both the upper and lower arches that allows them to align really what it seems to be more consistently. We see less areas where there's more alignment in one area and less alignment in another area because the wire is dialed in all the way across the arch based on the amount of force needed for each tooth's periodontal ligament and the inner bracket distance between each teeth. I mean, it really is a smart wire, SmartArch. The wire costs a little bit more, but 2 wires that each cost a little bit more compared to 4 wires that cost a little bit less, it's you've already saved some money. Some docs would argue that an appointment doesn't cost that much because it's a couple of minutes of staff time, but I would argue that it's a cost of a mom getting out of work to get their child out of school, to come to your office, the inconvenience, the customer service, not to mention the time in the office, having to see more patients, having to run a busier schedule, etc. So I think if you had a busy practice and you could save 2 appointments for every patient that you treated, think about how many appointments that is over the course of the year. It could mean that your day runs with 10% less patients and runs a little bit more smoothly, or you work a few less days a year. As a doctor, there's a doctor value. So it'd be hard to put a dollar value on it, but it's incredibly valuable to me in my practice.